Chapter 17, Therapeutic Agents for the Nervous System. We will go over these terms and definitions throughout the chapter. I do have psychosis highlighted, so let's go over that really quick. Psychosis may be a true mental illness due to an underlying medical condition like dementia, drug withdrawal syndromes, could be induced by medications, recreational drugs, or poisons. This chart here is select common drugs for conditions of the nervous system. This is a nice chart because it tells you how to pronounce the medication's generic names, which is usually the most difficult. And it kind of groups together everything by what it's for. So Alzheimer medication, anxiety medication, these are the most common. So at some point, you're going to want to make sure you're learning the brand and generics of common medication names because you will find those on the pharmacy technician certification exam. And obviously, when you're working in your job, you're going to have to know them because the patients are going to be asking you about them all the time, or nurse, depending on what setting. So we won't go over all of these, but we will talk about them through the chapter. The nervous system coordinates our body's actions. It enables us to interact with our environment. Our nerves allow us to detect and respond to stimuli, which is changes within or outside our body. And the nervous system maintains homeostasis, which is an equilibrium. The brain, the brainstem, and the spinal cord form the central nervous system, which we commonly refer to as the CNS. The peripheral nervous system, which we commonly abbreviate as PNS, is outside the CNS and includes afferent, which sensory, and efferent motor branches. The afferent sensory division transmits impulses from the body's organs and tissues to the CNS. The CNS then interprets those signals. The motor division then relays the interpreted impulses to appropriate organs to trigger an effect. We further divide the afferent system into the somatic nervous system and the autonomic nervous system, which we abbreviate as ANS. The somatic system relays motor impulses to skeletal muscles, and the autonomic system transmits motor impulses to smooth muscles, which is the muscles surrounding our blood vessels, cardiac muscles, and glandular tissue. The ANS has two main branches, the sympathetic nervous system, which we abbreviate as SNS, and the parasympathetic nervous system, which we abbreviate as PSNS, which we will talk about more later on. Here are the divisions of the nervous system, which include the somatic and autonomic branches. The somatic division sends and receives impulses to and from the muscles, whereas the autonomic system regulates both the sympathetic and the parasympathetic systems. Central nervous system, PNS. The neuron is the smallest unit of the nervous system. Billions of neurons run through our bodies, carrying messages back and forth. They have four main sections: the cell body, the dendrite, the axon, and the nerve terminal, which you can see all in this picture once I scroll down a little more. The dendrites are extensions that receive electrical impulses from the previous neuron's nerve terminal. The cell body processes the electrical message before it enters the axon. A special insulation called a myelin sheath covers many axons. The covering consists of phospholipids and proteins and accelerates impulse conduction. And the small gaps are the synapses. And here's the picture, so you can look at it a little bit better. Chemical message conduction from one neuron to another causes three basic cell membrane changes: polarization, depolarization, and repolarization. And here's a chart that kind of just depicts that whole process, the impulse transfer cycle. What is a neurotransmitter? Neurotransmitters are chemicals located in and released by neurons. They provide impulses emitted and sent from one nerve cell to another. And here is a good picture that kind of represents the lock and key mechanism. So like when you go to the doctor and they tap your knee with the little thing, as the knee is tapped, impulses are sent to and from the brain. The neurotransmitters affect specific receptors that are interpreted. The reaction sent via neurotransmitters is to jerk the knee. The central nervous system includes the spinal cord, brainstem, and brain. The following sections outline the primary functions. The brain has several sections. The largest area of the brain is the cerebral cortex that has gray matter lying over white matter. Gray matter includes neurons, cell bodies, and dendrites. This is where most neuronal activity happens. Language, memory, and cognitive functions occur in the gray matter. The white matter consists of bundles of nerve fibers. They function to communicate between other areas of the cerebral cortex and brain. We divide the cerebral cortex into left and right hemispheres. Hemi means half. The two halves communicate through the corpus callosum, which is a bundle of axons. And then we further divide the two hemispheres into four different lobes with specific roles. The frontal lobe controls motor function, parts of speech, emotions, problem solving, reasoning, and planning. The parietal lobe is important in orientation, recognition, sensation, and understanding language. The occipital lobe is important in controlling perception and interpretation related to vision. And the temporal lobe is important in receiving and integrating auditory stimuli and regulating emotion, personality, and behavior. The brainstem connects the brain to the spinal cord and has three main areas: the midbrain, pons, and medulla oblongata. These three areas link to many nerves in the brain, and the thalamus is above the brainstem. That serves as a relay station that transmits messages between the brain and the spinal cord. It sends messages to the proper area in the cerebral cortex. At the back of the brain, near the brainstem, is the cerebellum. This many-folded brain section carries responsibility for precise movements such as maintaining balance, posture, and coordination. So here's just the lobes of the brain, the cerebellum and brainstem, which are all part of the nervous system. When we discuss drugs that treat neurological disorders, we must include the BBB, the blood-brain barrier, that prevents certain molecules and substances like bacteria from entering. The spinal cord is inside the vertebral column. It serves as a path from the brain to the PNS. Vertebrae protect the spinal nerves. A watery liquid called the cerebrospinal fluid, which we abbreviate as CSF, cushions the brain and spinal cord. So here is a picture depicting segments of the spinal cord. 12 pairs of cranial nerves originate from the brain. These nerves, designated by Roman numerals, have specific functions. The numerals represent the fiber's location from the brain's front to back. Most nerves have sensory and motor fibers. 3 sets have sensory fibers only. Table 17.1 will list the primary functions of the cranial nerve sets, nerves 1 to XII. So again, table 17.1. So you can read through all of them. One is olfactory, and this is the cranial nerve, and this is what it functions to do. So for example, cranial nerve number 3 is oculomotor. That is the cranial nerve it is. And the muscles are involved in movement of specific regions of the eye and eyelid. Facial nerves involved in sensation of taste in the front of the tongue. They're linked to face and head muscles and result in our facial expressions. A lot of these are kind of interesting to think about because we don't think about them, but they're just happening at all times. We divide the PNS into the autonomic and somatic system. Each system has specific roles. The ANS, the autonomic system, controls automatic functions, which include unconscious heart beating and breathing. We further subdivide the ANS into 2 main branches, the SNS and the PSNS, and these regulate organs, tissues, and blood vessels. The SNS responds to stressful situations. It is the fight or flight response. During this stress response, the SNS shuts down the body's non-essential systems. It redirects energy to other areas such as the muscular system. The main neurotransmitters of the SNS are norepinephrine and epinephrine. 4 main receptor types respond to these neurotransmitters. Peripheral blood vessels, the heart, and the eyes have alpha-1 receptors. We primarily find alpha-2 receptors on smooth muscle. Primarily beta-1 receptors are in heart muscle and beta-2 receptors are in the respiratory system, blood vessels, and elsewhere in the body. Drugs that mimic natural SNS neurotransmitters are sympathetico-mimetics or adrenergics. And table 17.2 is the select effects of adrenergic receptor activity in the body. So alpha 1, the effects are our eyes dilate, our heart rate increases, and peripheral vasoconstriction occurs, which is narrowing of the blood vessels. We think of the PSNS as the SNS opposite or counterbalance. The PSNS activates the digestive system. This function includes secreting acidic juices, increasing peristalsis, and inducing pancreatic insulin release. The PSNS works while we rest. The sympathetic system cannot or can override the PSNS during intensely stressful periods. The main PSNS neurotransmitter is acetylcholine. It is important in both the CNS and the PNS. And 2 cholinergic agent types, agents that activate the PSNS, may either mimic acetylcholine or stop its destruction by acetylcholinesterase, an enzyme. Parasympathetic mimetics are cholinergic drugs that mimic the PSNS. The somatic system is a nerve network that relays messages from outside of the body to the CNS and then returns those messages. Nervous system dysfunction produces many conditions. Because so many disorders and diseases can affect the brain and nervous system, we only discuss a sample of the major indications and medications to treat them. Myasthenia gravis is a rare autoimmune disorder that affects electrical impulse transmission from the CNS to the body muscles. So here is a little depiction. And then it kind of goes over the prognosis, non-drug treatment, and drug treatment for each condition. And then it lists medications for the condition. So for our myasthenia gravis, we have the medication Mestinon, and then it gives you like the route of administrations, oral and injection. the common adult dosage, the mechanism of action, the side effects, and the auxiliary labels. So these chapters are good chapters to help you complete your med list. We have the medication Imuron, also for autoimmune disease. Polyneuropathy manifests as distal loss of sensation, burning, or weakness, depending on the involved nerves. Polyneuropathy has many causes. It can be diabetes, alcohol misuse, human immunodeficiency virus, so HIV, certain medications' adverse effects, and among other things. For that, we have the medication Cymbalta, which can be prescribed for diabetic neuropathy. And if you look at the chart in the beginning of this chapter, it's actually listed under depression. So this medication first came out on the market for depression and clinical trials. They found out that it works for nerve pain and diabetic neuropathy and things of that nature. The medication Neurontin gabapentin is really popular for neuropathy. There's creams such as capsaicin cream, which is the trade name is Zostrix. Epilepsy is a seizure disorder marked by hyperexcitability in some brain nerve cells. The two main types are partial and generalized seizures. Partial seizures affect only one brain hemisphere, and they may cause relatively mild symptoms. Generalized seizures affect both hemispheres. Epileptic children often have petit mal seizures. This causes them to stare into the distance for a time. And grand mal seizures, also known as tonic-clonic seizures, the person loses consciousness and falls to the ground. Periods of widespread muscle spasms, which is the tonic phase, alternate with muscle relaxation periods, which is the clonic phase. Injuries can occur depending on when and where those seizures take place. The person seizing will not remember that episode. So table 17.3 lists the different types of seizures and what happens during them. So partial seizures, we have the simple partial motor type, simple partial sensory type, and the complex partial type. Generalized, we have absence, which are called petit mal, akinetic seizures, myoclonic seizures, status epilepticus, and grand mal, which are tonic-clonic. Here are select anticonvulsants for the treatment of epilepsy. So it gives you the generic name, the trade or brand name, and the common adult dosage per day. So carbamazepine is pretty popular drug that you see a lot for partial seizures and for generalized tonic-clonic seizures. You see I've highlighted do not stop taking abruptly. And again, for the medication phentoin, which has a trade name of Dilantin, it says do not stop taking abruptly. So for seizure medications, you cannot stop taking them abruptly. That definitely can onset unwanted seizures and unwanted reactions and stuff of that nature. Diazepam is available as a rectal gel. It's used for intermittent treatment of generalized tonic-clonic seizures and for status epilepticus. And it is a controlled substance, so it has federal law prohibits the transfer of this drug to any person other than whom it was prescribed for, and it is a rectal gel. Alzheimer's disease is a progressive condition associated with memory loss, confusion, impaired judgment, personality changes, disorientation, and loss of language skills. It's most common in elderly patients, but it can occur in younger adults. Stages associated with Alzheimer's disease. So there is 7 stages. So it lists the symptoms and the descriptions. Stage 1, no impairment or normal functioning. And then 2, very mild decline. 3, mild cognitive decline. 4, moderate cognitive declines. And then, of course, it tells you what kind of happens along the way. And then 7, very severe cognitive decline, the severe or late stage or the last stage of Alzheimer's disease. The person loses the ability to speak, control movements, or respond to their environment. They may lose the ability to feed themselves, use the toilet, walk without assistance, or sit without support. They may not be able to smile or hold their head up. And as reflexes continue to decline, their muscles become rigid and swallowing is impaired. This chart 17.6 has select medications for the treatment of Alzheimer's. Parkinson's disease is a progressive basal ganglia disorder associated with the loss or deficiency of dopamine, a neurotransmitter. The overall degeneration of dopamine producing neurons instigates symptoms. We use the acronym TRAP to talk about symptoms: tremor, rigidity, akinesia, and postural instability. As this is a progressive disease, symptoms get severe over time. Sometimes physical movement slows and then they eventually become wheelchair bound. They can have other issues like swallowing and speech difficulties, constipation, and cognitive impairment. Scientists have linked the development of Parkinson's disease to genetics and environmental influences, though as of now, the ultimate cause is unknown. So here's just a picture depicting some of the signs and symptoms. We have select medications in table 17.7 that treat PD. I have highlighted the medication levodopa. It is converted to dopamine in the central nervous system, which helps manage the motor symptoms of Parkinson's disease. The carbidopa blocks the peripheral conversion of levodopa to dopamine so that it can reach the CNS. So those medications is a combination medication called Cinnamate. We have dopamine agonists that mimic the actions of dopamine in the CNS to help treat the motor symptoms. The medication amantadine may increase dopamine availability in the CNS, and it is also helpful due to the anticholinergic effects. The medications Comtan and Tasmar help prevent the peripheral conversion of levodopa by the enzyme COMT, which is this catechol-O-methyltransferase. MAOI-B1 inhibitors, so monoamine oxidase B inhibitors, they inhibit MAOB and decrease the metabolism of dopamine in the CNS. So here's those medications: Azilect, Zolapar. We have anticholinergics like Cogentin and Artane. Anticholinergic activity reduces the excessive cholinergic activity, which is present in Parkinson's disease. And here's just some more information on those medications. Multiple sclerosis, commonly abbreviated as MS, is a chronic neurological condition. It affects the myelin sheath's integrity on neurons in the CNS. Myelin covers the axonal portion of neurons and helps facilitate proper nerve transmission. MS is an autoimmune disorder in which the immune system breaks down the myelin sheath. After immune system damage, hard tissue replaces the myelin sheath. Electrical impulses cannot pass from one neuron to another effectively, which leads to impaired movements and other neurological deficits. And 17.8, table 17.8 lists disease patterns or types of MS. So we have the pattern primary progressive MS, progressive relapsing MS, relapsing remitting MS, and secondary progressive MS. And you can read the descriptions of all of those different types of MS. A lot of medications for MS are injectable. So we have the medication Avonex. It is an IM injection. The medication Rebif, which is a subcutaneous injection, so just under the skin. Also with beta-seron, subcutaneous injection. The medication Capoxone. The medication dalfampridine is oral. Migraine headaches are episodic. Severe headaches frequently cause nausea and or light and sound sensitivity. Migraine triggers vary from one person to the next. They can be from hormonal changes, food, stress, bright lights, or other environmental changes. Most cases, there is no identical cause. Drugs can influence migraine frequency and severity. Serotonin agonists frequently treat migraines. Migraines are common and affect about 12% of the population. There's no cure for migraines right now, and you can look at some non-drug treatment and drug treatments. The medication Imitrex. It is available as an oral, a nasal spray, and a subcutaneous injection. The medication Relpex. It's only available as an oral. A stroke is an arterial blockage or hemorrhage blocking blood to the brain. Strokes have several causes, but most cases are ischemic strokes. The decrease of blood flow to the brain happens when a clot blocks the blood vessel or the vessel becomes too narrow. This blockage or restriction deprives the brain of oxygen and the brain cells can die. Although the disruption is specific to the vascular system, it also affects the nervous system and its functions. Damage severity depends on the blockage size and how much it harms the brain tissue. Effects range from limb weakness to being paralyzed on one side of the body to the loss or the ability to speak. The most common symptoms of stroke include severe headache, dizziness, visual difficulties, loss of balance, difficulty moving one side of the body, weakness in facial muscles, and that causes difficulty speaking. Depression. The World Health Organization lists major depression among the most burdensome diseases in the world. In the United States, the lifetime prevalence of major depression is approximately 16%. I'm sure that that number has went up since this book was published with the pandemic and inflation and the way our world is. I'm sure that's going to continue to go up. Depression types range in severity from minor to major depression with thoughts of suicide. There can be postpartum depression after pregnancy, seasonal affective disorder, depression during the winter months. Major depression can be difficult to treat. It hinders a person's ability to function normally, and it hinders activities such as sleeping, eating, working, studying, and forms of enjoyment. Many times, depression coincides with a severe illness or anxiety disorder. Depression medications increase brain levels of neurotransmitters, and under normal circumstances, neurotransmitters stimulate the brain as they are released and then they are reabsorbed by the brain cells. Because people with depression may lack adequate levels of neurotransmitters, antidepressants work to increase the neurotransmitters available to the brain. Table 17.9 lists select medications that are available for the treatment of depression and their class. We have SSRIs. They increase the amount of serotonin available in the CNS. SNRIs, serotonin norepinephrine reuptake inhibitors, commonly abbreviated as SNRIs, increase the amount of serotonin and norepinephrine available in the CNS. Tricyclic antidepressants, TCAs, primarily increase availability of norepinephrine and serotonin in the CNS. MAOIs, monoamine oxidase inhibitors, inhibition of the MAO enzyme leads to increased availability of neurotransmitters such as norepinephrine and dopamine. Bupropion increases the availability of dopamine in the CNS. This medication also works for smoking cessation. Trazodone increases the availability of serotonin in the CNS. Vilazodone increases the availability of serotonin in the CNS and is a 5-hydroxine tritamine receptor partial agonist. In here, just list some examples of those medications that we've previously talked about. Anxiety disorders. So unease and fear characterize anxiety, and these are normal psychological reactions. It becomes problematic when it interferes with daily personal and social interactions. It may elicit panic attacks or compulsive behaviors. Anxiety can be expressed as a feeling of fear or dread, with symptoms ranging from a rapid heartbeat to trembling. We divide anxiety disorders into several different types. These range from panic disorders, such as post-traumatic stress disorder, and phobias, to personality disorders, such as obsessive-compulsive disorder. Some anxiety disorder types include the following: generalized anxiety disorder. Here, a person experiences constant anxiety and worries continuously about common life problems over a period of 6 months or longer. Social anxiety disorder, also referred to as social phobia. A person experiences constant anxiety and extreme fear around others. They attempt to avoid public situations and people. This avoidance stems from overwhelming fears of being humiliated, being judged, or feeling uncomfortable. This condition disrupts the person's normal daily activities. Panic disorder and anxiety disorder that includes panic attacks. Situation events can trigger these attacks. During a panic attack, the person experiences severe apprehension, fear, and terror. In addition to physical complaints such as dizziness, heart palpitations, or shakiness, severe panic disorders can lead to phobias and PTSD. PTSD is a condition that follows traumatic or terrifying incidents. Sight, sounds, and even smells can prompt flashbacks, nightmares, and constant memories. Soldiers returning from war are a common group suffering from PTSD. Other people who may suffer from PTSD include rape victims, those exposed to violence, those diagnosed with a life-threatening medical illness, and these can occur any time after the precipitating event. Phobias are marked by irrational, persistent fear of situations, people, or things. The person suffering from a phobia experiences several symptoms, including a rapid heartbeat, shortness of breath, and trembling. Treatment ranges from psychotherapy to anti-anxiety medications. So now we will list the medications for anxiety disorders, much of which are controlled substances. They are easily abusable. You can see an auxiliary label for most of these medications is avoid alcohol. You should never take alcohol with an anxiety medication. It can cause respiratory depression. All benzodiazepine medications are Schedule 4 medications. The only one, as I talked about earlier, is buspirone. That is not a controlled substance. Patients with bipolar disorder may experience excessive mood swings that range from manic, which is high, to depressive low states. Specific symptoms of mania include agitation, hyperactivity, inflated self-esteem, risky or reckless behavior, and decreased sleep. And here are just some examples. We have lithium, Vraylar. And all patients taking lithium must have their blood levels monitored regularly for toxicity. It can take several weeks to see the desired effect of this agent. Lithium is kind of an older medication used for this. More than likely, it's not being prescribed to like newer, younger patients, just because of all of its side effects. Schizophrenia is a psychiatric disorder involving chronic or episodic psychosis. It can cause impaired social and occupational functioning. Schizophrenics commonly exhibit both positive and negative symptoms. Positive symptoms can include hallucinations, delusions, and disorganized speech. Negative symptoms can include depressed mood and impairments in attention, memory, and high-level functioning. The schizophrenia diagnosis comes from the presence of symptoms in addition to diminished social function and or occupational dysfunction for at least 6 months. Although the exact cause is unknown, it has a strong genetic component. Some risk factors are living in an urban area, immigration, birth complications, a birth date in late winter to early spring, a reflection of influenza virus exposure during neural development, and they have higher rates of other psychiatric disorders such as depression, anxiety, substance abuse relative to non-schizophrenics. I have highlighted in drug treatment a particular devastating adverse reaction that can occur while taking antipsychotics is tardive dyskinesia. I'm sure you've seen commercials about this. These symptoms can include involuntary movement of the face, muscles, tongue, jaw, and head. If these symptoms appear, the medication must be stopped immediately as these effects can be irreversible. It almost causes like a tic, like almost like a tic that a person would do. I can't think of what the thing is called right now because my brain's overloaded, but yes, you know what I mean. We have medications that treat schizophrenia. Haloperidol, we already kind of talked about that. One of the side effects is tardive dyskinesia, and it is available as an oral solution, as an oral tablet solution for injection and suspension for injection, which is that long acting. This medication is great for long acting because if a person has acute psychosis or schizophrenia, sometimes they can be nervous or be paranoid. So it's hard for them to hard for people to get them to take pills. We have the medication Clozaril, which has a risk of hematological effects, including a granulocytosis. It is available only through a monitoring and distributing system to ensure that patients have received appropriate blood monitoring. And I remember what I was talking about before, Tourette syndrome. It's almost like a tic that you get with tardive dyskinesia. Is almost kind of like a tic you get with Tourette syndrome. Like you almost don't have control of what you're doing in your face. Except for you're not obviously saying things crazy. You're just kind of making weird movements. Here is some more medication for schizophrenia. And we have different dosage forms for the medication risperidone. The medication Abilify is indicated for schizophrenia, agitation, depression, and bipolar disorder. Same with the medication Geodon. Insomnia. So patients with insomnia have impaired daytime functioning due to a difficulty falling asleep or difficulty maintaining sleep, or they experience poor quality sleep. A person is considered an insomniac when all three following factors are present. They complain of difficulty falling asleep, difficulty maintaining a sleep, or waking up too early. The sleep difficulty occurs even though the person has an adequate opportunity to sleep, and the impairment in sleep causes difficulties in daytime functioning. An estimated 30 to 50% of the population has insomnia. And we have medications that are approved for the treatment of insomnia. So benzodiazepines. Benzodiazepines are also used to treat anxiety. These ones listed here usually are given for the treatment of insomnia, not anxiety. We have non-benzodiazepine hypnotics, melatonin receptor agonist, like melatonin, which is just natural, or the medication Rosarum. We have dual orexin receptor antagonists like Balsamra and antihistamines that are actually over the counter, Benadryl and Unisom. And this is just kind of going more into it, listing the routes of administration. All of them are usually oral. Zolpidem is available in a few different oral dosage forms. I believe it's available in liquid and tablets and controlled release tablets. ADHD is a physiological brain disorder where a person struggles to focus his or her attention or to engage in quiet, passive type behavior or both. Boys are 3 times likely as girls to warrant an ADHD diagnosis, which affects 3 to 5% of school-age children. Signs and symptoms can be impulsive, explosive, or irritable behavior. And here are select medications in Table 1711 for the treatment of ADHD. Most of these here are controlled substances and they're C2, so the highest controlled medications. Adderall, Focalin, Focalin XR, Adderall XR, Dexedrine, Vyvanse, Concerta, Daytrana, Metadate, Metadate ER, Methylene, which has been discontinued, and Ritalin. So all of these medications here are all the medication methylphenidate. Ritalin was the first one on the market, I'm pretty sure, and then they made extended release tablets so the patient didn't have to take as many pills during the day, which is nice because most of the time it's children school age, they have to leave their classroom to go take the pill. Most of the time you can give it to them before they go to school so they don't actually have to take it at school, or they only have to leave the classroom once a day. There is a patch, so it's applied once daily in the morning and can be removed after 9 hours. There is Metadate CD, so extended release capsules, Metadate ER, and regular immediate release Ritalin. We also have the medication atomoxetine, which is not a controlled substance and usually kind of the first line of therapy for kids that may be displaying symptoms of ADHD. So we would try to give that to them first before putting them on these other stronger medications. So you can see the side effects. Trouble sleeping is a big one because a lot of these are derivatives of amphetamines. Smoking cessation is a difficult process that the pharmacy staff is usually involved in, from recommending OTC products to providing counseling and follow-up with prescription products. Prescribers can employ the antidepressant Zyban or the medication Chantix to help patients quit. Here's just some more medication or information about the medications. Chantix is oral. And here's the common adult dosages. And we already kind of talked about Zyban before. That is a medication. Bupropion, which is also used for depression.